How is pressure used in laparoscopic surgery, and why would it be used?
So inside the abdomen, we have a potential space. Okay, so that potential space we can put air in, and that air then can give us a working space. So if we don't have air in there, we put a scope in or whatever, we can't see. There's just no space in there. We're just going to be all pushed together. So we put the air in there to lift up the abdominal wall, which then creates a working space so we can see what we're doing. So that's why we use the air and pressure.
So for laparoscopic surgery, what do you inflate the abdominal cavity with, and why do you use it?
So depending on the patient's body habitus and size, will depend on how much air we have to put in, how much pressure we have to put in. Someone that's got very little abdominal wall or very skinny, we will use 10 or 12 millimeters of mercury pressure. Someone that's morbidly obese or weighs quite a bit will go up to 20 or 25 if we have to.
And you use CO2?
We use carbon dioxide for the air that we put in because it's physiologic. Our body produces it every day. We breathe it in and out. It's a very safe thing. And anything left in there, we try to get all of it out when we're done. But if anything's left on the inside, our body absorbs it and we can breathe it out or actually convert it to water and we pee it away.
So in order to perform laparoscopic surgery, how much intra-abdominal pressure is needed?
Yeah, so again, it just depends on the procedure you're doing, how much visualization you need to do, where you're at inside the abdomen. If you're up underneath the diaphragm, you're going to need a little bit more pressure. If you're down the pelvis, because the bony structures of the pelvis help hold things apart. So you won't need as much pressure then, but if it depends on where you're at and what you're doing and how big the patient is. If you have a big, heavy, thick abdominal wall and a lot of weight, you got to give it a little more pressure or you're not going to get any space. So it just kind of depends on the situation, the patient, and what you're doing.
Would inflating the abdominal cavity have any long or short-term effects?
So yes, it can have a couple different effects. One of them is if you put too much pressure in there, you're going to decrease your preload or your blood return to the heart. So if you go above the pressure of the vena cava, which doesn't take much, it's 5 to 10. So if you go above that, you're going to basically stop the blood flow from your legs back to your heart. So you're going to decrease preload. And if you're in a surgery that's 3 or 4 hours long, you could definitely have some hemodynamic effects. If we increase our pressure too rapidly, too fast, our patients get hypotensive to the point where we have to either let some of the pressure away or give some medicine through anesthesia to help augment their blood pressure. Thank you. You're welcome.
Thank you.
You're welcome. Any
Thank
other
you.
questions?